The popular nasal spray version of the flu vaccine doesn't protect kids the way it was supposed to. In a surprise decision, health officials are advising doctors now to not use the FluMist vaccine this year, a reversal from its previous stance. Meg Tirrell has more on this change in diagnosis.
It was the only option for flu vaccine that doesn't involve a needle. The FluMist nasal spray is made by UK drug maker AstraZeneca and accounts for about a third of flu vaccines given to kids in the U.S. But according to the CDC, it provided only 3% protection against the flu last season. That compares with 63% for the flu shot.
Over the last 3 years, we've been hearing that the effectiveness of the nasal spray has been less than has been expected. But I think I was a little surprised that it was as low as the CDC says it is.
Manufacturer AstraZeneca claims FluMist provides 46 to 58% protection, according to its own studies and those of public health authorities in other countries. It says it's working with the CDC to better understand its data and to try to ensure Americans can receive the nasal spray vaccine in future flu seasons.
Once we find out why it didn't work, there can certainly be changes made so that that form of vaccine will hopefully show equivalent efficacy again.
In the meantime, AstraZeneca says it expects very limited U.S. demand this year due to the CDC's recommendation FluMist not be used. FluMist brings in more than $200 million in annual U.S. sales for the British drug maker, which now plans to write off $80 million in inventory in the second quarter. The company is not the largest provider of flu vaccines in the U.S. Sanofi, GlaxoSmithKline, and CSL all make more. But AstraZeneca had planned to supply as many as 14 million doses, or about 8% of the total flu vaccine in the U.S. this season. The CDC says it'll work with other manufacturers through the summer to ensure there's no vaccine shortage. But parents and pediatricians will have to brace themselves for a change. The CDC still recommends a flu shot for people aged 6 months and up.
Knowing that the shot works fairly well and that influenza is a major cause of problems and deaths in this country means that it's going to be very, very important to really stress the point that everybody needs to get an influenza vaccine.
In fact, I got my first flu shot last year as part of reporting for a story. I was surprised it didn't hurt more.
That's it?
For Nightly Business Report, I'm Meg Tirrell.